Hello everyone, I'm Russ McLean, Chairman of the Pennine Lancashire Patient Voices Group, and today I'm in conversation with Kevin McGee, Chief Executive of East Lancashire Hospitals Trust. Kevin, hello.
Good afternoon, Russ.
So we meet again on what is the first day of another junior doctors' strike, but this with the difference, as the junior doctors have said that they will not provide emergency cover. Cancer services, maternity services, accident and emergency services, critical care and mental health services could all be adversely affected. So, first of all, could you tell me how many planned operations have had to be cancelled because of the strike?
So overall, over the next today and tomorrow, we've cancelled just over 100 planned elective operations, which is quite a sizable level of activity.
What then happens to those people whose operations you've had cancelled? Do they go to the front of the queue? Do they go to the back of the queue? What happens?
So it's based on sort of clinical need and clinical priority, and what we try and do is get those patients in at the earliest possible slot, but it is based on clinical need and clinical priority. Really do apologise for anybody who's been inconvenienced and had their operation cancelled. We really do know that this is this is not the right way and not the right thing to do, but we've had no other option but to do it.
So we've had four previous strikes, but this one, as I said earlier, is with a difference because they've withdrawn emergency care. Now, our patients have obviously talked to me over the past couple of days and with shock and horror, and said that, what happens if you're involved in a car accident, God forbid, or you need urgent medical attention? Will that be affected, their care?
So I can absolutely reassure anybody who needs the services they will be treated efficiently, and there'll be no safety issues at all. What we've done is all our senior consultants, the very senior, most experienced staff, are on all our wards and departments. So we've cancelled holidays, study leave, administrative tasks, and everybody's just focused on keeping patients safe in the wards and departments.
There will have been a significant cost to this strike, not only to the health economy, but surely to the trust. Is that the case?
Yes, there is, and you can look at that different ways. So the way we receive our income to pay for staff, etc., is through the work that we do. So if we've cancelled operations, clearly there's a loss of income to us as a consequence of that. But there's also other costs. So as I said to one of your previous questions, Ross, we will keep the system safe, we will keep patients safe, but that's based on an awful lot of planning. There's hours upon hours of people's time gone in over the last few days, very senior doctors and nurses, administrators, really planning to keep the system safe, and there's an opportunity cost for that. So whilst they're doing that, there's other things that they can't do. So clearly, yes, there is a cost over all of the strikes.
Let me throw this at you. What happens if the junior doctors continue with the strikes? There was talk recently of them striking for several days or even weeks at a time. Presumably that would have a horrendous effect on operations here and at all trusts across the country.
My job and the job of the senior staff here is to make sure that we keep the hospital safe and we keep the hospital running, and we will do that whatever the circumstances. But clearly, I understand the concerns that the junior doctors have, but the longer that they are on strike, the more difficult it becomes for us. I would hope this was the last strike. Clearly that's completely out of my sphere of influence. All we can do and all I can do is to make sure that if they do have any more strikes, we keep the place as safe as we possibly can.
You mentioned it a couple of moments ago, but what would you like to say to the patients of Pennine Lancashire, who are your patients, to put them at ease during these times of strikes?
So I think there's two key messages. As I've said to a couple of questions, Russ, we will always focus on keeping the system safe, keeping patients safe, and if you need our care, please don't worry about coming, because you will be treated appropriately. But the other message is, particularly through our A&E department, really just think about whether you need those services. If at all possible, think about other services. So can you use your GPs? Can you even go to your pharmacists? Is it something that you can self-care? So if you don't need the A&E department, please just think very carefully about using it. But if you do, as I said, you will absolutely have the right level of care.
The strike, of course, has been rather unprecedented in that junior doctors have removed that emergency care, and I'd like to stay with the unprecedented theme. by casting your mind back to Chorley Hospital and their closure there of their accident and emergency services. How much, if any, effect has that had on your emergency services?
We understand the reasons why they had to make the decision they took over Chorley. It was for staffing, and there's some national issues with staffing, and clearly we're under the same pressure. So I've got a great deal of sympathy in terms of what went on and why they've done what they've had to do. Clearly, however, we have to look and see what the implications will be for Blackburn. So we are monitoring on a day-by-day basis whether there has been any increase in numbers as a consequence, because clearly if it does start to increase, we will need to look at our staffing levels. Have we got the right staffing levels? Have we got the right seniority? Do we have the right space and capacity to cope with any increase? So we're monitoring it on a day-to-day basis. My working assumption at this stage is that there may be a small increase over a period of time, but we'll need just to monitor that very carefully.
The closure of the Chorley Hospital seemed to come out of the blue for patients. The question, therefore, that follows is your A&E adequately staffed, and could there be a time ever that you would decide to close your A&E because you didn't have the staff?
There are some real national issues in terms of staffing for A&E departments. It's nationally. Every trust, every A&E department in the country is under those pressures. But if you think about the A&E department in Blackburn, it's actually the busiest A&E department in the northwest, bar none. We have more blue light ambulances coming here, significantly more than any other site. So it would be inconceivable that we would close it for any reasons. What we have to do is to think very carefully, however, for the future about how we do staff it, and we're currently working through those plans.
Let's talk about one of your hospitals that you've had to close one of your services, and that's the Accrington Victoria Hospital, where you've chosen over the last 2 doctor strikes to close your minor injuries units there. Tell me why that happened.
The closures are very temporary as a consequence of the junior doctor strike. We have some very skilled and very dedicated staff who work in that unit, but so we could concentrate our resources, we've asked those staff for the period of the junior doctors strike to support the services on the Blackburn site and to support the services on the Burnley site. That unit will reopen on Thursday, and we have no plans to do anything else but to keep that unit open and fully staffed.
The Patient Voices Group has noticed significant improvement from your communications department over the last 2 years, and of course I was delighted to receive the news that Christine Hughes has been appointed as Communications Director. She has been the interim Communications Director for a couple of years now. How confident are you going forward in the ability of the communications department? You must yourself have noticed quite a change during your tenure as Chief Exec.
So I think one of my key responsibilities is to set a tone in the organisation, the culture in the organisation about open and honesty. So I put a lot of store by really good communication with staff, good communication with patients and their relatives and stakeholders in our communities. So this is a really, really important piece of the job. We don't always get it right, and I suppose we'll always get criticised by some people for how we communicate. However, what I can assure your listeners is that I take this really seriously. I want the organisation to be completely open, to be completely honest, to celebrate its successes, but also to recognise when it gets things wrong, it has to learn from those mistakes.
Over 12 months ago, the Trust, in association with several local healthcare organisations, put together a bid for £3 million for the Prime Minister's Challenge Fund to build a new primary care access centre, which was to be built on the Royal Blackburn site. Can you tell me about that? Has it progressed, and what are the plans going forward?
So one of the problems that we face on the Blackburn site is that we've got limited capacity through our urgent care and A&E centre. So part of the idea was to use some central capital money to increase the capacity for basically anybody who would turn up for A&E, urgent care, etc. walk-in issues. We are currently working with our colleagues in the CCG, Blackburn McDarwin CCG, to develop and set up the new unit. We still have ambitious plans for what it will look like, but we're currently working that through with our CCG colleagues and I'm hopeful that over the coming year that will start to take shape.
The Trust is on a quest to become dementia friendly, or actually, more accurately, more dementia friendly. I heard recently that you'd brought in these blue plates. Can you tell me more about them?
No, absolutely. So colour is really, really important to anybody who has any sort of diagnosis or is suffering from dementia in any way. And being able to present food on plates that are blue, not white, just helps people with eating and just makes life a lot easier. So we are very dementia friendly. If you go onto our wards now, any new ward is being upgraded or designed in colours and that will help with dementia. And clearly we're thinking about every aspect of their life, food and eating being one.
I know we spoke briefly when I arrived today about people taking photographs in the hospital, and that actually quite alarms me, and I know it troubles you too.
No, it does, and we've had over the last few weeks a number of instances whereby people have taken photographs, particularly in the A&E department, and clearly that is a breach of staff confidentiality, but also patient confidentiality. Clearly people who turn up in A&E, many of them are very distressed, many of them are there because they need very serious treatment, and people going around taking photographs without any form of permission, I think it's just not acceptable.
Well, I think I would add that obviously we live in a digital age where everyone has a phone which has a camera upon it. But I should perhaps remind people that hospital property, the trust property, is private property, so you shouldn't really be taking photographs anyway.
No, I just feel it's really, really inappropriate. I don't know why people would do that and want to do that. And it clearly breaches patient confidentiality, but also staff confidentiality.
Let's end on a positive note. I read recently, or heard recently, about a member of your staff who'd actually talked a chap down from a very tall mast. Could you tell me more about it?
Yes, so the lady was a member of our staff. It was a lady called Jo Listman who was actually on call at the time, and a distressed member of the public, who was a patient, actually climbed up a tall mast, and it was quite a dangerous situation. It was very sort of cold evening, and Jo spent a lot of time really showing compassion and care for the person, and talked them down. And I'm happy to say it was a really happy ending. There was no damage done, and it just shows, Jo really went out of her way to help and support this member of the public.
Finally, we've had a very troubled winter as far as A&E and hospitals go, nationally, not just locally. Have you a message for the patients of East Lancashire to ensure that going forward these services continue? So
we provide really good first-rate services within East Lancs Hospitals Trust, that be across all our sites. The area that we've been under the most pressure is through our urgent care and A&E departments, and we want to make sure that they are the highest possible quality, but are there for the patients who really need them most. So again, my message that I repeat on many occasions is, if you need our services, absolutely, please come. But just think, if there's other ways that you can get your care and treatment, and if you don't need particularly A&E services, please think about not turning up.
Kevin McGee, Chief Executive of East Lancashire Hospitals Trust, thanks for your time.
Thank you, Russ.